is going to be led off by Ms. She is a social worker. I told my wife and daughter are social workers. I have great respect for social workers. And she is going to talk with us from the perspective of a parent. So.
My name is Catherine Snedeker. I'm up here today as a parent. I also myself have had double-digit concussions, and my brain is already donated to the BU CTE study. I haven't heard yet whether we can split it among a number of studies, but so far BU has my brain. I also have 3 sons, of which together have had 12 concussions. I have parented through concussions for the last 5 years. I also have a number of websites, and one of them I actually just started 2 weeks ago, which is called pinkconcussions.com, which is very interesting because everyone's been talking about female concussions. So what I'm trying to do is find the subsets and research, find the stories, find the sources to put together for women on one site. So today I wanted to talk about the concerns and issues faced by families of concussed athletes. Are parents concerned about concussions in youth sports? The answer is no. All parents are not concerned. They're concerned at the extremes. There are parents that are very concerned about concussions, extremely so, and there are parents that don't care, they don't worry about it, and you're just wasting their time. And you have to really work with those two groups because there's basically nobody in the middle. The parents get it. The parents that come to your concussion education night, they come to your films, they come to the teacher trainings, those are all parents whose children have already had concussions. They get it. The parents that don't attend are the parents whose kids had it yet. And that may sound really basic, but I keep getting together different groups, and they run these concussion education nights, and the same 60 people come, 40 people whose kids have already had concussions, and trainers and 10 coaches. And then we sent out 2,000 emails, and I'm like, it's the same 60 people that show up. The concern also varies by sport. We have a lot of focus on football right now. I'm starting to see early at the cheerleading level. Again, if you're a daughter who has had a concussion, you're very much interested, and if your daughter hasn't, you're not. Also about geography. Habits are changing. Parents are starting to be more aware. You cannot have gone through the last 2 years and watched CNN without having seen a story on concussions. And there's the risk in general, but still it's not specific to their own child. There's a denial that my child won't be the one that gets a concussion. They're more concerned about purchasing equipment. What equipment do I buy? What's the best helmet? And tell me that my sport is less risky. If I'm a hockey parent, tell me that my sport is less risky than football. They don't use the statistics to teach sports, but they usually use the statistics to justify the sport that their child is currently in. Well, they're not playing football. Concussion education, a no-brainer. Organizations are really hesitant to require parental education. I went out to a school on Long Island, Cold Spring Harbor, and they required all 500 kids and their parents to show up and hear me talk for 20 minutes. And signed off on their concussion education form. Then they went to a team meeting. They were tired. They'd just gotten off the train from New York. We made it very entertaining, and they ended up loving it. But it's a little hard when 500 people are forced after work to come hear you speak. But voluntary, very few parents attend. They have other things going on. It's not that they don't care about their kids. They just don't see concussions as an issue. When it's mandatory, the parents make time because they want their kids to play. It's something they need to check off. Parents support mandatory coaches training, and they're fine if the kids go to a program, especially if it takes place instead of a practice. Again, the parents are concerned with long-term TI already have experienced concussion. So it's the same people showing up again and again. Missed pieces of the puzzle, there's mixed reaction when baseline testing is offered. A couple of years ago, you used to see hockey teams say everybody had to be baseline, and saying that, they're backing off a little bit, I think, with the liability. So they offer it. When I go to a team and I offer baseline testing, generally a third of the parents will sign up. And again, most of those have kids who have already had concussions or the siblings have had concussions. And the parents get baselining. I'll get a call back from a parent that said, Johnny got a concussion. I don't get it. He was impact tested. No, that's not the point. You paid, $25, $35, $45, $50 for this test, and you still don't get. It's like I say, putting the kid in the back of the pickup truck on the highway and driving around real fast, and they fall off the back, and you look at the impact test to see how hard they hit the pavement. You have to put the child in a car seat with a safe driver initially. You can't take these baseline tests and think they're going to protect your child in any way. Parents really understand what a concussion is. There's a study, a really good study, that shows that 7 out of 10 adults don't know the signs of a concussion. That was the American Osteopathic study. It came out this fall. Don't understand the spectrum of return to school, TBI. Again, if they had Brenda's program, brain steps, they would. A lot of the things that I talk about, Brenda's program addresses. The system is missing the person to manage how the child is doing. Report to parents. Is it the MD? They don't have time. The AT, they're sports related. School guide counselor, do they have the training? With Brenda's program, they would. First, to treatment. Very few parents understand the current and correct management of concussions. They just don't get it. Well, now we talked this morning about how many doctors don't understand it. And if they're trained MDs, they're very limited in the country. I've also seen experts have long waiting lists. Right now, you can't get in to see Bob Cantu unless it's a sports-related. The last concussion was a sports-related incident. If you have a child that falls on the steps, the clinic won't see you right now because they have to focus. There's so many people coming in. If you have a 9-year-old with a concussion, try getting into a concussion expert. It's really hard to get into anyone if you're under age 11 because that's outside the realm of impact testing. How can concussion change your life? It's that call. I see the nurse's line on my phone. I get that text from my child. I hit my head. This is my son who's had 10 concussions. He started in 6th grade, and he got a concussion at recess, getting hit by a soccer ball. He was out for 3.5 months, and we had a lot of friends up at Yale, and we went through everything. And basically, this is 2007, and nobody had an answer for us. When a child is concussed, it's a sudden medical crisis. It's a change of routine, missed days of school, cancels vacations. You suddenly have a child to take care of that may be even taller than you. It's not babysitting a 3-year-old. Wages goes down, and you have the sibling issues. One of the greatest pieces of advice I give people when they call me with a concussed child, I ask about the siblings, and I say set up some sort of bribe system. So if the concussed kid hits the siblings don't hit back. Parents think that's kind of a strain, but after a couple of days living with a concussed child who's really cranky, and siblings want to hit them, those bribe systems come in to protect the concussed child. So injuries are true. Those things are just true if it's a broken leg. But why concussion is different? It's an invisible injury. The medical advice varies between doctors. The ER can send you home saying it's a grade 3 concussion. You come home, your pediatrician's like, oh, we don't do grading system. Keep them out of school for 3 weeks. And then you go to a concussion expert in 3 weeks, and they're like, oh, they should have been back to school. There's not a consistent medical program out there. Parents are lost how to take care of their child. There's also the perception that they're faking the injury. This is really a factor. And if you talk to kids, they really do feel like if they walk in and the nurse gives them some negative comments, oh, you're back again, they will not be honest because they had administrators, they've had other parents, they've had coaches, they've had people tell them that they probably aren't hurt. The parents need to manage the child's absence and return to school. Within the length of crisis is unknown, how long it's going to be. Usually with a broken leg, I think there's sort of idea of when the child's going to be, on crutches, walking with a boot, etc. The stress between parents, if it isn't mutually agreed on, dad can say, well, if they're going to stay home with a headache, why don't they go to school with a headache? Give them an aspirin. Cope with a cranky child, the mental health aspect, the diagnosis can be challenged by friends. About 72 hours, people stop being compassionate about a concussion. Everyone's compassionate about 3 days, and then they're, These photos from my kids from Facing Concussion Project, and these are teenagers. The top part of, these are kids that have concussions. The top thing shows Roman numerals. That's the that's the high point of the day. Sometimes it's food. Their friends, if they're home for weeks and weeks on end, end up being the cat, or they're looking out because they're off screens or looking at nature. You find kids taking pictures of their equipment, or I have a lot of pictures of kids taking pictures of the teams playing off in the distance and they can't play. This slide of casseroles delivered to my house, and this is my view. Divorce, I got a really great casserole, had bacon on the top. I lost my house in Sandy this fall, and I got about 5 or 6 meals delivered. About 6 weeks diagnosed with breast cancer, 6 casseroles. I cannot keep my friends from stopping to make me meals. I haven't even started chemo yet. I can't get these women to stop cooking for me. Concussions, 0. Never bought me a casserole. And it isn't because my friends aren't loving, they just don't get the concept. We haven't taught them yet about how to care for people with concussions. So how needs to be addressed. I'm running out of time. Bad news is we're lacking a lot of stuff we talked about today. Good news is the training exists, programs exist. I just found out about Brenda. I'm going to drag that back to Connecticut. There's a lot of resources. The recommendation, the flow of information, we just need to get the training to the doctors, the education to the parents, and teach families how to support each other. If you've got 60 people on a team, someone's going to get a concussion. What if we taught everybody, hey, bring them a casserole. Hey, help with the other siblings. Let's just, you can't directly help your child. Why don't you help a group that may be less threatening? Accountability, these stats from schools and organizations, and fund the future. Encourage new models, encourage mental health, encourage funding for ATs and training, and better statistics.
Thank you. Our next speaker is Dr. Michael Gray, who's representing or is the Vice President of the National International Alliance for Youth Sports. Dr. Gray.
I have set. Thank you, Catherine. That was excellent. There have been some excellent presentations here today. I've taken copious notes. My only regret is I've a large enough notepad. Things, I'm writing things on the back of notepads and the back of the program and everything. But there were some excellent presentations today. I'll kind of follow what Catherine did. I'm a university professor. I'm an exercise physiologist, and I'm a single parent. But in reality, I'm not here in any of those roles today. I'm here to address a passion that I have. And passion is reducing concussions in youth sports, and wrote about many things, many positive, informative techniques, medical, physiological. But I think sometimes, and this is where my passion comes in, we're only talking about the top portion of the pyramid, if you understand what I'm speaking of. And I think Dr. Moskowitz addressed it, and Dr. Duma addressed it, talking about the vast number of participants in sports that are in scholastic sports, not in the recreational, we call them organized sports. I've been around them. I see very little organization, to be honest. And the bottom of the pyramid, and if you know anything about what's the largest portion of the pyramid? It's the base. And I think too often we focus on the top and we don't pay enough attention to the base of the pyramid. And if you've been to youth sports events, you don't see team physicians at a youth sports event. You don't see a certified athletic trainer at a youth sports event. You're lucky if there's an EMT person there. So I want to address that issue because that is a big passion of mine. How do I get this to go? There we go. I think all agree prevention is more important than treatment. We have some excellent presentations today about treatment, ways to treat patients when they come to see either the pediatrician, the GP, or a neurologist. But I talk a little more about being proactive rather than reactive. I think we would all agree that's always the best way to go. Prevention is always better than treatment. And I'm not downplaying the treatment that we've heard today, and I'm not demeaning that because I thought it was excellent. But what I think we need to do is I think we need to step back a little bit and think about some things for this youth sports group, not organized scholastic group, that we do in order to prevent concussions from occurring, wait until they happen, and then try to treat concussions. Some people, Dr. Duma talked about it, Dr. Guskowitz talked about this. Rule modification is critical. We disagree with that. My gosh, even the NFL, who I think is always the slowest body in sports to recognize anything, less money is involved, and I really think that's probably why they now have changed some rules. They've modified their rules now about hits to the head, blows to the head. The NCAA has done that. Many organizations now coming out about that. Phil, I'm not sure if you're aware of this or not, or even talking about widening the football field. And ex-collegiate football player, I think that's sacrilegious, but if it's to prevent injuries, maybe I'll support that. But I think we have to agree that rules is critical. You know, we have to change rules to keep kids safer. There's been one coach, I'm not going to mention his name here, even mentioned a radical thought for collegiate and high school athletes: remove face mask from the helmets. We don't have to worry about people hitting with their heads or leading with their heads. That's true. And back when I played, there was a portion of time when I didn't have a helmet on my face mask, which is probably why I look like I do today. But we didn't do a lot with our heads back then, but we weren't taught to lead that way. In my couple of years in college, we were taught to lead with our heads. So I think it comes back to rule changes. I really think we need to look at the rules, and I also think coaches need to teach kids safe play. There's a difference between an unsafe and a safe play. Tremendous difference, and it involves sportsmanship. Our young coaches, youth coaches, need to teach kids sportsmanship and safe play. They go hand in hand with technique. It's all life skills. I've just developed, for the youth sports group I work for, a program on life skills in youth sports. How to teach a child to develop life skills. We all assume magically it occurs, like osmosis, and that's not true. And the reason this was brought to my attention, I had a parent, this isn't what I'm here to talk about, who said, my son doesn't get anything out of it. He sits on the bench all the time, so why should he play sports? That's a great question that I don't really have an answer for. So we find a program to help them develop life skills. Fair play, sportsmanship. Proper fitting of equipment is essential. That's been addressed several times today. Everything has to fit properly to protect adequately. But the problems I've noticed, and I've coached at all levels. I've coached in college, I've coached high school level, and I spent most of my time at the youth level because I had 3 sons who came up and played sports. And being a single parent, it was another way for me to be involved with them. Plus, I wanted to protect them from some of the lunatics that are out there. That was the reason I was a youth sports coach. And one of the first things I noticed is that there's 2 problems with equipment. One, most youth coaches have no idea how to fit equipment properly. They don't know. It's not because they don't want to know, they haven't been trained. And so there may be great equipment out there, but if it's not fitted properly, or it's not being used, or it's not being purchased, that's a problem. That's a huge problem. And the second problem I always notice, they have great equipment, they may have been taught how to use it, but if the child doesn't put it on properly or doesn't wear it at all, then another issue, and that comes to parent education. Okay? Comes quickly to this. What I'm talking about is coach education, and several people have alluded to this already. I think training of coaches is vital. You coaches, they have to know the things to do to keep our children safe. And teaching them, and Dr. Guskowitz, that one slide up here, the one video, showing the 3 kids hitting head to head with the football helmets. My God, someone should have stepped in immediately and said, you tackle that way, son. You get injured if you hit that way. And the training of coaches is vital. These coaches need to know how to tackle correctly. What kind of drill should these kids be going through? So I cannot stress strongly enough coaching education. And coaching education ought to follow two different roads. Prevention. Coaches need to understand the rules. They need to teach the kids safe play. They need to know how to fit equipment properly. A lot of people, individuals, and from Knox, he was here earlier. I guarantee you most representatives will come out and fit or teach coaches how to fit equipment for kids if asked. Is another one, probably the most important one. We need to educate the coach. We need to educate the parents, which is something Catherine was getting into, and we need to educate the players. The coach needs to basically know the symptoms of a concussion. The parent needs to know the symptoms. Parents watch their child much more than the coach does. My gosh, we use the term helicopter parents. They're always watching their child. And I think the child needs to be aware of symptoms. I'm not feeling right, coach. I can't remember the play. I walked into the wrong huddle. So I think it needs to be an approach for all 3 groups. I know the organization I work for, National Alliance for Youth Sports, we're working with the CDC, and we've developed a program. It's called Heads Up for the coaches who go through our program and the parents who go through our program, and it's a free online program. Saying go through our program, but I'm saying it needs to be done. I know that Dr. Bob Graw out here from Maryland, his medical office brings parents in from the community for free and tests the kids, teaches them about the kids, parents and coaches about concussions. But that's just one example. I'm sure there's more, but I think we need to be a little more rigid about coaches learning these things. That some states, 44 states, have mandated coaches training. You know, the training only applies to school coaches. Volunteers aren't even mentioned in most of the legislature, and the rules are very vague. They even stipulate what the training should be. And I think a thing we need to think of, you're about youth coaches. How many of you in here have ever coached or seen a youth sports game, a youth activity? Everybody. I'd have been amazed if I hadn't had 100%. All these people are parents who may work in a gas station, may be a restaurant manager, work at Kroger's or wherever, Costco. They went to college. They haven't had anatomy and physiology classes. So we hit them with some of these courses that I've seen out there. We've lost them. It needs to be, and I don't like to use this term, dumbed down, maybe geared down to the level. It needs to be appropriate. The level of intensity for these courses needs to be appropriate. So, in conclusion, what I'm saying here, we've taught all these steps to reduce concussions in youth sports. I hope this committee comes out with a recommendation that mandates training of coaches that work with the majority of children. You heard numbers, 7% of kids who play tackle football are below the age of 13. 4 kids play football in the United States, 3.5 million of them are below 13. We mandate these volunteer coaches are trained. Okay? At the bottom of the pyramid, not focus on the top. Thank you.
Thank you. We'll hear from Mr. Triplett, who give us the perspective of a sports official.
I want to thank for inviting the group. Probably gets forgotten more than anyone else. The sports official out there. Yeah, I am a professional sports official, but I started at the Pop Warner in the high school at the lowest level. So one of the things we want to talk about is, what do we have to change? And what do we have to change in the official's mindset out there? We're those, as I call them, first responders when someone gets injured. So what do we have to change about officiating? Officials, all of us used to play the game. So if you got injured, you toughed it out when you got hit. You didn't worry about that. They can do it too. We have to change that. We have to change. They keep changing the rules. It's too tough. We're going to take the toughness out of the game. That's officials saying that, folks, at the levels. That's an attitude change that we must change. Officials have to be taught when a player gets hurt, they get back and call help. Now, I mean, we thought as a sports official, when someone gets hurt, first thing is call timeout and get the help out. Different question. What happens if you're sitting in an intersection, you just at the stoplight, and cars collide, you run over, you pull the person out of the car, and it just so happens simultaneously an ambulance pulled up with 2 first responders, and they treat the person. After they just look at them quickly, they turn to you and ask, what happened? They see what happened. None asked a sports official on injury what happened. It was an aha moment for me when Dr. Meyer said this to NFL officials last year. We've all trained to take a step back, assume that folks saw the injury take place or the incident that occurred to take place. He showed some film about players where someone was getting treated for an injury on the sideline, and lo and behold, we have an incident that occurs in the field. They come out and treat not the concussion, but a hand injury or a foot injury or something else. So, we have to change the mindset of officials on the field. And say, most folks say, we're not doctors, so we shouldn't get involved. Again, I have to diagnose something. I just need to help folks understand if I've seen something. Someone also has to ask me, but probably not been asked before. Again, you have to educate officials. I've heard folks talk about educating parents, and we need to educate us. We need to understand about concussions. I will say, last year, the NFL undertook the effort to go out teach those of us on the professional level that you're talking about, probably at a pretty high level. I'm not going to have to do that at every level, but we need some basic education and understanding, even at the lowest level, basic education. We have to teach folks about angular acceleration. I mean, we do a little bit of physics. That's okay. Okay? We got to teach folks about the symptoms. We got to teach officials how to recognize if they see someone exhibit the symptoms of concussion, and to help them understand what incidents might lead to a concussion. It's not just the head-on-head hit. It's shoulder going against the head of a kid as they're passing by. When they fall and they bang somebody's knee with their head in hockey. Those are the things we have to teach officials to be aware of. And why rules have to change. This, again, a mindset that we have to educate officials of why we have to change the rules. And we have to hold officials accountable. We adapt to protect the players. To teach officials to err on the side of safety. I can't comment enough. I think the NCAA, the football supervisors, I'll tell you right now, the college football supervisors are the ones at a meeting earlier this year that said to the athletic directors and the coaches, we need to disqualify a player who targets another player above the shoulders in contact of football. And we need to say they're not going to play the remainder of the game. As up here earlier, changes in attitude of players, coaches, or teammates by instituting fines or suspending them a week later. The big thing that any athlete wants to do is participate at level. They want to play. And they can't play. They hurt themselves. Their mates get upset with them, and their coaches get upset with them. Start saying, you're not going to play because you committed this foul. They will adjust. As we talk about teaching the first responders to ask us what happened out there. Simple little thing, but it goes a long way. Again, actions, good bodies have to mandate that officials get the training and track that training. If you look, the state of Ohio is one of the recent states, but there's legislation actually identified not just coaches, but identified officials. Any official that participates in supervises an activity has to go through that, and going to have to go through that annually. I keep repeating this, but it is so simple. We've just not done that. We heard today about video documentation. One of the things that we have to do with officials is show them examples of what is an incident that could lead to a concussion. We have to start identifying what actions on the field might lead to a concussion. And potentially could be a foul. That's something you need to call. If you have trained yourself to at least to know what the foul is, change the rules, then we aren't going to recognize them. So no different than anyone else. When I talk about we have to discharge officials who will not enforce the rules. We need to put rules in. We aren't going to hold officials accountable. We aren't doing the job. Officials need to be moved aside, and because it's protecting the players at what level it is. Finally, we need to figure out how to report all these kinds of concussions or these incidents at all sports. To help officials understand, is it football? Is it girls soccer? Hockey? What kinds of incidents that lead to the concussions? Help understand, so we might say this is how the rule needs to change. And if we do that, we'll make the sport safer. Thank you.
Thank you very much to the three of you. First from the committee for our panelists.
Walter, Medical College again. Mr. Triplett, I know the NFHS a few years ago recommended that officials be allowed to identify players with suspected concussion symptoms. Do you have any experience or feedback on how that has gone?
They are, you're exactly correct. The High School Association and the National High School Association is actually put online a new video that they're encouraging. The states are adopting that as the concussion training of how to recognize and requiring all officials to go through that every year in every sport. So it's we just have to do. I think it's an opportunity to do even more of that and track that training and to make sure that we keep officials learning more about this, because candidly, we know a lot about it at all the levels. I think we're now beginning to understand. I draw the analogy, years ago, we used to have blocking below the waist. We've had all these knee injuries, and so we finally ended up deciding we'll do blocking below the waist in high school. Did it the game? Certainly. Did it away with the game? It did not. Coaches adapted. Players adapted. And I am convinced in every sport, folks understand the risk and the consequences. They will adapt.
Yeah. Other questions? Any questions from the audience for our panelists? A couple of minutes here.
I have one thing to add.
Go ahead.
One of the things that I wanted to mention is in the concussion world, there is no pharmaceutical answer. And my feeling is that a lot of the foot soldiers out there for training pediatricians and training doctors are pharmaceutical reps. And they come in with the drug and they explain to the MD what this drug is for and how to use it. And that's a lot of the education that happens. And there isn't a profit-driven model like that in concussions. So we don't have those. There is a pharmaceutical rep knocking on the doctor's office, training them. And without that flow of money and information, if Eli Lilly could make money off concussions, we would have doctors being sent to places and, all this sort of education. And it's hard to find profit in concussions. A lot of pediatricians are finding that sort of the opposite of strep throat. Strep throat, the kid comes in, they give him a test, they give him a prescription, and 12 hours later the kid is better and the parent's happy. With concussion, you have multiple visits. There's nothing to write on the prescription for the parent, and the parent's like, why isn't my kid better? So I think it's hard. I've seen impact tests go into pediatricians' office. Pediatricians thought they were going to make a lot of money off of it, and then a fourth of the kids have to retest. That's now 2 sessions for the price of one, and pediatricians are pulling out impact testing. So, again, who's going to fund this? Because nobody's making a lot of money in this. There's a lot of really good programs, but where's the money going to come from?
Thank you. Mr. Triplett?
I want to add one thing that I said to Catherine earlier. We all think about, on the sports official side, it's usually adults that does the officiating. At the youth level, at the Pop Warner level, at the community levels, it's probably teenagers. They are probably 18, 17, 16, 15 years old. So one of the things that I think we have to think about, they aren't governed by any officiating body like the National Association of Sports Officials that are getting training. I think one of your recommendations really ought to be is thinking about talking about who it is that's supervising, not only a coach, but who is also officiating these contests at this lowest level. It's really you're talking about folks that you just basically young kids looking at other kids officiating a game and trying to interpret the rules of safety. That's like putting the 10-year-old driving the car for the 13-year-old out there a lot of times.
I'll find with, look, I coached lacrosse for 8 years. I coached boys lacrosse. Within the first 5 minutes, the kids on teams are going to see how the officials react to their hits. And if they get away with stuff, then get away with it. It's that first 5 minutes where the official sets the tone of what plays I'm going to call, what penalties I'm going to call, and then the kids respond. But if Wild West is given an option, the kids will take it.
Okay. Any other questions? David, do you have a question? See the toy.
I just wanted to respond to Ms. Snedeker's comment about where's the money going to come from, which I think is a really good point in terms of physician education. But just I don't think that the way that drug companies educated physicians was a good model either. So,
but the model we have.
Not anymore, though. Not anymore. It's really less than it used
But they're
to be.
still in the hallways giving out the prescriptions. They're not sending them to Mexico. No?
No, not anymore. Let's see, this lady here has a question.
How do we best educate our athletes in order to be their own proponents? So on the field, they've taken a fall, and generally their coach is like, come on, suck it up, out there and play. How do we make them their best, advocate, or their teammates their best advocate? If you see your teammate down, you saw what happened better than anybody else does. What's the magic phrase we can tell them to use, or the thing that they can look out for in order to stand up to your coach who's, been your role model and your support? Tell them, no, I'm not going on the field. No, it's not safe.
I've got
Hold on, could you just identify yourself?
I'm sorry, I'm Meg Jewett. I'm just a mother athlete.
Great, thank you.
Meg, don't say you're just the mother. That's 2 full-time jobs. Meg, let me give you a website to go to. It's NIS.org, NIS.org. And that's just one website. That will link you to multiple others. But one of the things we do through the organization I work with, we train the coaches, we train the parents, and we train the kids. There's lists for all of them. The coaches go over the lists of things to look for with the child. Like, did you forget a play? Did you get up and you were a little dizzy after that? Just a list of basic things. Children, we need to understand that. They're not easy interpreting. But the parent also needs to reinforce, and the coach goes over it, the parent goes over it. They're getting it from both sides. And the coaches and parents is where the real problem comes in. Because I've been around youth sports so much, I've seen the good and the bad. Bad is when you have the coach whose team is down by 1 point, it's a championship game, and his star athlete gets dinged. The coach says, no, you're fine. How many fingers did I hold up? What day of the year is it? Whatever. And parents exactly the same way in many instances. The parent gets upset if the coach takes their son or daughter out. So it got to be almost a triangular approach. They all three have to understand the seriousness of a concussion. And in some instances, if the parent's a lunatic, that transcends to the child. They have this the military put up a slogan here, which I thought was great, was the warrior mentality. You know, to do a lot of work for DEA on steroids, and we used to use with elite athletes the idea of the bulletproof or invulnerability mentality. And kids get this. You know, coach says be tough, and parent says be tough. Well, they won't report injuries. Everybody has to know that's not right. So we take an aggressive, long-term approach. But we have to start somewhere.
What I do when I train young athletes is we role play and have one be the coach and one be the parent and one be the kid, and we'll play different arguments. And I also do that with coaches too, so that you just can role play what it feels like to be the coach and want the kid back in, what it feels like to be the kid and want to be pulled out, and everybody takes a different scenario. The other thing I do is I take injured high school athletes who have lied about concussions or have played through concussions not knowing they were concussions. I take them into middle schools, and 5th and 6th and 7th graders, when they see a high school kid walk in who wants a high school football player or soccer player and is going to tell them about concussions and concussion education, those kids listen. And, you know, you have one of the speakers, I have a guy named Chris Coyne. He's going to be speaking at Seattle. And he's amazing. And I've taken him to inner cities. I've taken him to prep schools. I've taken him to dams. And he tells his story. And one of the kids wrote one day that said, you know, I heard a kid talk about his 6th concussion. I found out concussions separate you from the things you love. Wow. And that was really powerful to me that a kid got that from another kid.
Just to kind of underline what Catherine just said, kids, especially in youth sports, look up to athletes. And to them, the athlete begins at the high school level. You can be a college or a professional athlete. You know, she was talking about taking speakers to groups. Well, you can't always access a collegiate or professional athlete. You can always access a high school athlete. And they're willing to go. They think it's cool. You know, the kids look up to them. And I think that's an excellent point. It's a good way to send that message.
And the other thing for the high school athlete is they're seen as an athlete again, you know, and they walk out of that presentation. It's very addicting. I have people that are like, when can we go again? Because you get, you know, 30 or 200 kids listening to you talk about your sports career, and also give you something in your college application, and they feel good about it, you know. It's a really feel good. So I think it's good for the healed or recovering or benched athlete to have that experience to talk to the little kids. And I think little kids are open to it, where they're not so open to it in 10th grade. You know, there's the peer pressures. If you're a sophomore, you've got a starting position on a football team, you're going to say you have a concussion and let some other sophomore take that over. That's a prized possession. 5th and 6th grade, like, wow, you hit your head, you have a headache, you sit out. It's pretty dumb not to. You know, they're a little more practical when they're younger.
I want to thank the committee, the panel here for their discussion and contribution today. Thank you very much. In the